Cefdinir, Omnicef, Uses, side effects and more.
Cefdinir, sold under the brand name Omnicef, is a third-generation cephalosporin antibiotic widely used to treat various bacterial infections. This comprehensive guide covers everything you need to know about this effective medication, from its uses and dosage to potential side effects and storage recommendations.
What is Cefdinir?
Cefdinir is a broad-spectrum, third-generation cephalosporin antibiotic that treats various bacterial infections by disrupting bacterial cell wall synthesis. It works by binding to penicillin-binding proteins, PBPs, in bacterial cell walls, preventing bacteria from forming their protective barriers and ultimately causing bacterial cell death. In India, Cefdinir is marketed under several brand names including Adcef, Cefdinir, Zinir, Aldinir, Maxicef 300, Ceftin, Ceftial, Zefnir, Edinir, and Cefdinir. It's available in multiple formulations, including capsules, typically 300 mg, and oral suspensions for pediatric use.
What are the benefits and uses of Cefdinir? Cefdinir is an effective antibiotic used to treat a wide range of bacterial infections throughout the body.
Its broad-spectrum activity makes it valuable for addressing various types of infections.
Conditions Cefdinir treats. Cefdinir is primarily prescribed for respiratory tract infections, bronchitis, pneumonia,
ear infections, otitis media,
sinus infections, sinusitis, throat and tonsil infections, pharyngitis, tonsillitis,
skin and soft tissue infections, cellulitis,
uncomplicated urinary tract infections, UTIs. Secondary uses of Cefdinir.
Cefdinir is often prescribed for individuals with severe penicillin allergies as an alternative antibiotic option. It's also frequently used in pediatric patients, with formulations specifically designed for children as young as 6 months. For UTIs specifically, while not typically a first-line treatment, studies have shown Cefdinir to be effective with a relatively low treatment failure rate, making it a valuable second-line option.
How does Cefdinir work?
Cefdinir works by interfering with a bacteria's ability to form cell walls, which are essential for bacterial survival and reproduction.
This mechanism ultimately leads to bacterial cell death.
Specifically, Cefdinir penetrates the bacterial cell wall and binds to proteins called penicillin-binding proteins, PBPs, which are essential for bacterial cell wall synthesis. By inhibiting these proteins, Cefdinir prevents bacteria from creating and maintaining their protective cell walls, causing structural instability and eventually cell death. Cefdinir is particularly effective against many gram-positive and some gram-negative bacteria, including common respiratory pathogens like Streptococcus pneumoniae and Haemophilus influenza, as well as many enteric gram-negative rods such as E.
coli and Klebsiella. How to use Cefdinir.
Dosage: take Cefdinir orally, with or without food, as directed by your doctor, usually once or twice daily, every 12 hours.
Shake the bottle well before each dose.
Duration: continue taking the medication for the full prescribed duration, even if symptoms disappear after a few days.
Stopping the medication early can cause the infection to return.
Interaction: some medications, such as magnesium or aluminum-containing antacids, iron supplements, or vitamin/mineral products, can interfere with Cefdinir's absorption.
Maintain a 2-hour gap between these and Cefdinir. Iron-fortified infant formulas do not interfere and can be given concurrently. Cefdinir dosage.
The appropriate dosage of Cefdinir depends on the type and severity of infection, patient age, weight, and kidney function. Always follow your healthcare provider's prescription instructions.
Typical dosage instructions.
For adults and adolescents, 13 years and older. Common dosage: 300 mg twice daily or 600 mg once daily for 5 to 10 days. For UTIs, 300 mg twice daily for 5 to 7 days. For children, 6 months to 12 years. Dosage is based on weight, typically 7 mg per kilogram every 12 hours or 14 mg per kilogram once daily. Available as oral suspension, 125 mg per 5 milliliters or 250 mg per 5 milliliters.
Cefdinir can be taken with or without food.
If stomach upset occurs, taking it with food may help.
What should I do if I miss a dose of Cefdinir? If you miss a dose, take it as soon as you remember.
However, if it's almost time for your next dose, skip the missed dose and resume your regular dosing schedule.
Never take a double dose to make up for a missed one. What happens if an overdose occurs?
Taking more than the recommended dosage can lead to serious side effects.
If you suspect an overdose, seek medical attention immediately.
Symptoms may include nausea, vomiting, stomach pain, and diarrhea.
What to avoid?
While taking Cefdinir, avoid antacids containing aluminum or magnesium, iron supplements, or multivitamins within 2 hours of taking Cefdinir, as these can interfere with proper absorption.
However, iron-fortified infant formulas can be given concurrently with Cefdinir. What are the side effects of Cefdinir? Like all medications, Cefdinir may cause side effects, though not everyone experiences them. Most side effects are mild and temporary. Side effects of Cefdinir. Common side effects include black, tarry stools, diarrhea, chest pain, chills, cough, fever, painful or difficult urination, shortness of breath, sore throat, sores or ulcers, swollen glands, bleeding or bruising, tiredness, weakness, nausea, vomiting, headache, rash, high fever, hives, increased thirst, inflammation of the joints, irregular breathing, fast heartbeat.
If any side effects persist or worsen, contact your doctor immediately.
Precautions and warnings. Certain individuals should use Cefdinir with caution or avoid it altogether. Always inform your healthcare provider about your complete medical history. Who should avoid this medicine? Cefdinir should be avoided by individuals with known allergy to Cefdinir or other cephalosporin antibiotics, previous severe allergic reactions to penicillin antibiotics, use with caution, severe kidney disease without appropriate dose adjustment. If you are pregnant or planning to become pregnant, consult your doctor as Cefdinir can affect an unborn child. It is unclear if Cefdinir is excreted in breast milk. Consult your doctor before breastfeeding. Conditions where caution is needed. Use Cefdinir with caution if you have kidney disease. Dosage adjustments may be necessary. History of gastrointestinal disease, especially colitis. Phenylketonuria, PKU, some formulations may contain phenylalanine.
Diabetes, suspension may contain sugar.
Are there any age restrictions for using Cefdinir? Cefdinir is approved for children 6 months and older.
Dosage adjustments are made based on weight for pediatric patients. The safety and efficacy in infants younger than 6 months have not been established.
Alcohol or food interactions.
While Cefdinir is not known to interact with alcohol, drinking alcohol may worsen certain side effects like nausea, headache, and stomach upset.
It's generally best to avoid or limit alcohol consumption while taking antibiotics.
Possible interactions with other medications, drug interactions. Cefdinir may interact with other medications, potentially affecting their effectiveness or increasing the risk of side effects.
Medications that may interact with Cefdinir.
Antacids containing aluminum or magnesium, take at least 2 hours apart. Iron supplements, take at least 2 hours apart.
Probenecid may increase Cefdinir blood levels. Blood thinners like warfarin may increase bleeding risk.
Certain diuretics may increase kidney side effect risk. Oral contraceptives, reduced effectiveness possible with severe diarrhea.
Cefdinir may also interfere with certain laboratory tests, including some urine glucose tests, potentially causing false results. How should Cefdinir be stored?
Proper storage of Cefdinir helps maintain its effectiveness and safety throughout its shelf life.
Recommended storage temperature for Cefdinir. 4 capsules.
Store at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius.
Keep in a tightly closed container. Protect from light and moisture. For oral suspension.
Before reconstitution, store the powder at room temperature. After reconstitution, store at room temperature.
Shake well before each use. Discard any unused portion after 10 days. What happens if Cefdinir is not stored properly? Improper storage may reduce the effectiveness of Cefdinir or cause it to degrade prematurely. This could potentially result in treatment failure or unexpected side effects. Always check the appearance of your medication before use and never use expired antibiotics. Keep all medications, including Cefdinir, out of reach of children and pets. Never flush medications down the toilet unless specifically instructed to do so. Consult your pharmacist about proper disposal of unused medication. By following your healthcare provider's instructions and the guidelines in this comprehensive guide, you can maximize the benefits of Cefdinir while minimizing potential risks and side effects.